Dr. Rayfitch here from Vet Triage. It is Tuesday, January 14, 2025, 1:34 p.m. Pacific Time. We are still in this October 2024 edition of Veterinary Surgery. Here is the paper, Outcomes of Surgically Treated Sialoceles in 21 Cats, a multi-institutional retrospective study, 2010 and 2021. And this comes out of many universities. We have Ontario Veterinary College, we have University of Minnesota, University of California, Davis, Cornell University, whoop whoop, University of Montreal, University of Saskatchewan, Purdue University, North Carolina, Colorado State, Midwestern, in Arizona. And yeah, so right off the bat, number one, those of us who are surgeons especially know that feline sialoceles are uncommon to rare. Secondly, a sialocele is an accumulation of saliva around a salivary gland, usually either due to pathology of the gland itself or the salivary gland duct, or it could be where the opening, where the saliva enters the oral cavity through the opening of the duct. And then multi-institutional means there's multiple institutions that are contributing to this, which inherently is good because you can take a rare condition like this and compile a bunch of data together. It's bad because of lack of standardization. So right off the bat, you have pros and cons there. And then retrospective studies always have issues with standardization as well. And because it's happened over an 11-year period of time, that speaks to how uncommon this is. Basically, it's like 2 cats a year that are diagnosed with this. So uncommon, but very interesting. It'll help anyway, regardless, but just want you to be aware of all the pros and cons of a study like this. The objective is to report the outcomes of cats that underwent surgical correction for sialoceles, 21 cats. The most common presenting complaints for cats with sialocele was dysphagia and tylism. 2 cats had recent history of trauma. 1 had a concurrent sialolith, which is a salivary gland stone. Most cats displayed soft tissue swelling, with the ranula being most common. A ranula is just a unique word to explain a swelling underneath the tongue, usually affecting the frenulum, which is that fold of tissue underneath your tongue that binds your tongue to the floor of your oral cavity. They treated the cats with either a sialenectomy, which is removal of the salivary gland and its associated duct, and or marsupialization. Marsupialization is where you create a permanent opening so that the saliva can drain through a larger hole. And so typically when you marsupialize, you're making the opening in the oral cavity. Intraoperative complications occurred in 3 cats, post-op complications in 5 cats, no recurrence or development of contralateral sialoceles during the follow-up, and follow-up was at least 30 days in all the cats. It went up to 968 days. Conclusion, sublingual and mandibular salivary glands were presumed to be the most commonly affected glands, and this condition is considered rare. Introduction. Diseases affecting the salivary glands of companion animals are quite rare, making up 0.3% of complaints. Second most common reported is sialocele. Probably first most reported common is cancer, I'm going to venture to guess. A ranula is usually associated with a swelling that is secondary to a disease of the sublingual salivary gland. And in the picture below, you can see a schematic drawing of all the salivary glands in cats. Keep in mind there can be marked variation, not just between species, but between individuals in a species. So you can see there the zygomatic gland, the parotid gland, the mandibular gland, sublingual gland, buccal molar gland, and the lingual molar gland. Dogs are similar, but they do have differences as well. Materials and methods. 2010 to 2021 are the years where the study was conducted, and results show that the majority of cats, 52.3%, were domestic short hair, 19% domestic long hair. Male cats made up the majority of 57.1%. The mean body weight 4.9 kilograms, median body weight 4.1 kilograms. The mean age 6.2 years of age, median 5 years of age. Just so folks understand the difference between mean or median. Mean is also the average. So you're taking the total number, you're adding the total number of whatever and dividing up by how many individuals you measured. Median is the middle number. So it doesn't necessarily correlate to the average. Average is kind of spread over the number of cases you're talking about, whereas the median is the middle number present in that bell curve. Okay. So median age 5 years, mean 6.2 years. 7 cats were indoor only, making up 33.3% of cats. 7 were both indoor and outdoor, making up another 33.3%. Most of them ate a combination of kibble and wet food at 38%, and then kibble was second at 19%. Regarding clinical presentation, 52.3% had cervical swelling, dysphagia 42.8%, tylism 33.3%. On physical examination, 12 cats had a ranula, which is 57.1%. The median duration of clinical signs was 90 days, but ranged from 5 days to 3 years. Drainage was performed by the referring veterinarian in 57.1% of cases and were treated with antibiotics from the referring vet, 38%. No prior medical treatment had been attempted in 9 cases, which is 42.8%. The diagnostic cytology of aspirated fluid in 66.7%, diagnostic imaging 71.4%, and or histopathology is 71.4%. Imaging include radiographs in 14.2% and CT in 47.6%. And I would argue CT is the superior diagnostic. Radiographs are okay because sialoceles are so rare in animals that to see a stone on a radiograph is probably unlikely. If you're going to perform a sialodenogram where you inject dye into the salivary gland, then radiographs are probably more useful. But again, nobody does that. CT is the way to go, or MRI, I guess. But most of us will use CT because it's cheaper and faster. Okay, distribution of lesions. Lesion distribution was left-sided in 15 cases, which is 71.4%. Right-sided in 28.5%. Salivary gland removal surgery was performed alone in 52.3%. Removing the glands of the mandibular gland was at most common at 19%, and then that was followed by both mandibular and sublingual at 9.7%, and then sublingual 4.7%, molar 4.7%. 4 cats underwent only a marsupialization, 19%, and then both procedures, marsupialization and cyanidectomy of the lingual and submandibular salivary glands, were carried out in 28.5%. Surgical approaches include lateral in 33.3%, ventral 19%, intraoral in 19%, and then combining lateral and intraoral at 4.7%, and combining ventral and intraoral at 4.7%. 12 cats were prescribed postoperative antibiotics, 57.1%. Regarding complications and outcomes, intraop complications occurred in only 3 cats, which is 14.2%. Examples include linguofacial vein transection, the mandibular lymph node was removed instead of the gland, damage to the sublingual nerve, and then 23.8% have postoperative complications. In-hospital complications occurred in 14.2%. 2 cats had surgical site swelling at 9.5%. 1 was unwilling to eat post-op, 4.7%. Third cat reportedly pawed at its face for 2 days after surgery, 4.7%. Short-term complications include hemorrhagic purulent material, incisional swelling, and trauma to the lateral aspect of the tongue. A single cat had a long-term complication where it was pawing at its face. Follow-up, minimum of 30 days for all the animals, median follow-up, and all cats had a minimum of 90 days follow-up post-operatively. Okay, discussion. A clear cause for sialoceles not identified in most cats. Most commonly affected glands were mandibular and sublingual. So you can see there in the picture that would be number 4 and number 3. And that's consistent with dogs. More than 70% of cats in this study had a left-sided lesion, in contrast to what's been reported in dogs. These differences in cats include they have an additional molar salivary gland that sits on the lingual side of the first mandibular molar. The mandibular and sublingual salivary glands are more closely associated in the dog than the cat, which perhaps underlies the frequency with which these glands are affected. Dogs also commonly have more anatomic variation within their glands than cats, however, the significance is unknown. A slight predisposition in males has been reported in dogs with sialoceles. Greyhounds, poodles, dachshunds may have an increased incidence. In dogs, the most common salivary glands associated with sialocele formation are the sublingual and mandibular. Previously, it had been reported that the molar salivary gland, found only in cats, was not capable of forming a sialocele. However, a recently reported sialocele study in a British shorthair was believed to have originated from the molar salivary gland. Previous research has implicated trauma, sialitis, neoplasia, and dirophlariasis, which is heartworm disease, as conditions resulting in the formation of sialoceles in dogs. However, the majority of cats do not present with a clear etiology. Experimental attempts to replicate sialocele through damage or ligation of the glands or ducts has had mixed results. In dogs, attempts to provoke sialocele formation through ligation of the duct has not been successful, leading to thought that trauma may be a contributing factor. Conversely, ligation of sublingual salivary gland duct in cats produced subcutaneous extravasation of mucus in the majority of cases in one study, where sialoceles did form up to 1 year following ligation. As pointed out by another study, this delay may result in failure to associate a traumatic event with sialocele formation. Another study suggested that sialocele formation in the cat is dependent on macrophagic and fibroblastic reactions following insult to the gland and extravasation of mucus. A substantially robust response may cause the secretory acini, which are the glands of the functional components of the glands. They atrophy and prevent sialocele formation, while sialoceles may form when the extravasated saliva overwhelms the host inflammatory response. Marsupialization has been shown to be less effective than removal of the gland in dogs, probably due to the propensity for mucosa to heal and obstruct the site of the marsupialization surgery. Feline sialoceles, which may indicate that marsupialization of sialoceles in cats could be met with less post-op complications when performed in dogs. Overall, the occurrence of post-op complications was 23.8%, higher than dogs at 15%. Side effects of salivary gland removal include bleeding, seroma, infection, sublingual swelling, and recurrence in dogs. With the digastricus muscle, which is the main muscle which is the only muscle, I believe, that dogs and cats use to open their mouths, limiting access to a lateral approach, it is believed that the ventral approach may yield better success when removing sublingual salivary gland tissue in dogs. The ventral approach has less recurrence risk, but it's associated with higher wound complications in dogs. The relevance of this is unknown, but the sublingual gland reportedly second most commonly affected, at least in dogs. Recurrence of sialocele following salivary gland removal in dogs is 5 to 15%, and probably due to incomplete removal of the gland. Cervical swelling secondary to recurrent sialocele has been reported within 7 to 30 days following surgery and as late as 3 years postoperatively in dogs. This recurrence being reported within 30 days postoperatively by at least one study shows the lack of reported recurrence is promising. And that's it. That's the study. So not too bad considering what it is. They acknowledge all the weaknesses that I mentioned at the beginning of this video. And yeah, thanks for those who watch and support the channel. Feel free to donate and subscribe and do all the things. We'll see you in the next one. Bye.